Innocent systolic murmurs are due to turbulence across the normal aortic or pulmonic valve. These murmurs peak early in systole, as shown by this phonocardiogram. Listen to a patient with an innocent systolic murmur. I will begin with 3 normal beats and then add the murmur. These murmurs are usually heard best in the second right intercostal space when they are due to turbulence across the aortic valve. Innocent systolic murmurs can also occur due to turbulence across the normal pulmonic valve. In this case, the murmur is heard best at the second left intercostal space. This transesophageal echocardiogram shows the area at the tips of the aortic leaflets where innocent systolic murmurs are thought to originate. M-mode echocardiography has demonstrated high-frequency vibrations of the aortic valve which correlate with the pitch of innocent systolic murmurs. With practice, most physicians can reliably recognize an innocent murmur by the early peaking of this murmur and the lack of any pathologic findings. In older adults, systolic ejection murmurs are often attributed to aortic sclerosis with thickening of the aortic valve, as shown on the left. The thickened aortic valve in this setting identifies patients at increased risk of future cardiovascular events. Innocent murmurs, on the other hand, have no associated cardiovascular abnormalities, as shown by the normal aortic valve on the right. With practice, most clinicians can reliably recognize an innocent murmur by its early peaking and distinguish it from a late peaking murmur of aortic stenosis. Listen to the difference between these two murmurs. I will start with an innocent murmur, as shown by the phonocardiogram on the top, and then play an aortic stenosis murmur, as shown by the phonocardiogram on the bottom. And now aortic stenosis.